Okay, let me see if, have I got Dr. DeSoya, do I have you speaking? Can you speak?
Yes, I'm here.
Dr. Dodona, can you speak?
I can unmute myself, yep.
Okay, you can unmute yourself. Okay, my name is Maggie Klein. The Manor Club is welcoming all of you to tonight's Zoom program. We have as our guests two Pelham School psychologists, Dr. Dodona from middle school and Dr. DeSoya from Prospect Hill. The idea of this meeting was what our children may be experiencing from the pandemic. And we're going to go right ahead with it. The idea is that all of you are muted so that we won't hear your phone calls or dogs barking or anything like that. And what we will do is we'll have a presentation by Dr. DeSoya briefly and then Dr. Dodona. And you can start sending your chat messages to me. And at the conclusion of their brief talks, I'll start asking them the questions that you have. So I'll start with you, Dr. DeSoya.
Sure, thank you. And thank you, Maggie, for inviting me here today. It's a pleasure. Like Maggie said, my name is Sarah DeSoya. I'm the school psychologist. I'm one of 4 school psychologists in the district, in the elementary schools in the district. I started working at Prospect Hill in 2015, and I am the parent of a 1-year-old daughter. And Maggie asked that we share some of the things that we've been noticing or our reactions, what parents have been experiencing during this time of distant learning. And understandably, we've seen the challenges that come with this. And at the same time, I think we've witnessed some positive reactions and changes that have come in from this sudden halt in our life. You know, the reactions have really varied. So I think I'll talk about the reactions that I've seen. And then I know Dr. Dodona wanted to share some of the reactions she's seen in the middle school. And then I have some theories and thoughts and some of my own research on what I think factors that might mitigate the effects of some of the psychological effects of stress in children, some of the things that I think would be helpful. So the reactions that I've seen on the challenging side are from the young children are a lot of emotional regression. Typically, this is a response to stress that we see often, but increased clinginess, wanting to sleep in bed with parents, more baby talk, bedwetting, and other comfort-seeking behaviors. So this includes increased shyness. So a child who might have not been so shy in class may now all of a sudden might not want to participate in a Google Meet, which is atypical. Or a child who may typically be very outspoken in a class may not be as outspoken in their Google Meet. So just this emotional regression we've seen a little bit of. Parents have also expressed to me some dysregulation, which is not surprising, meaning tantrums, becoming easily frustrated. Children won't say, I'm struggling with some tough emotions right now, Mom. I'm not sure how to cope with it, or Mom or Dad. They're going to act out and they're going to behave in challenging ways. So this is what we've seen, just a real dysregulation, a lot more tantrums. We've also seen, as a result of increased screen time or a result of sleeping in later, we're not sure why, but trouble sleeping in children, some atypical resistance to tasks that usually kids wouldn't resist. So academic tasks that might have been easy before, but now aren't as easy, or they're just avoiding it, thinking, oh, what's the point? Those are more for the older 4th and 5th graders. I've seen that. We've seen family conflict. Of course, we've seen health concerns, more specifically in the families with healthcare workers or those living with grandparents or more vulnerable people. A high level of boredom I've seen in my students, and parents express what to do to help children with boredom, with I have my own theories about, but in general, a high level of parental stress, which makes sense. So parents are being asked to do everything. They have dual roles, there are limited resources, there are financial stressors, health concerns, isolation, loss. I don't even have to tell you guys to know that stress in adults is high. And when there's stress in adults, there's stress in children. So children look towards us to know what to do and how to react in stressful events. And I have seen a lot of parental stress, understandably so. And at the same time, I have also seen a lot of positive things that I didn't expect. Not that I had any expectations about this, because I'm not sure anyone did, but I've seen much more family time, something we haven't had for a long time, like meal time, breakfast, lunch, and dinner. I've had parents call me and say, I have to make breakfast, I have to make lunch, now I have to make dinner, everything. But new hobbies that kids are picking up on, they're seeing their parents do things that they haven't seen before. They're watching their parents work, which has its own effects. I think they're curious about what their parents do. And at the same time, parents get to see what children are doing for most of the day and how they're learning. One kindergarten student told me the other day that it was her night to cook because it was Tuesday. So she had to go because it was her night to cook. And I thought that was great because, she's starting a new hobby. That's something she wasn't doing before. So we've also seen some relief from students, especially those students who every day in school, social and academic pressures really get to them. And that the New York Times article that Maggie referenced really spoke to this too, that they appreciate having more time with their family because school was a place of stress. They might have experienced bullying or academic pressures. So now they have a sense of relief. And I've seen acts of gratitude. I've been so impressed with our Pelham community and the kids and all of the efforts to support the healthcare workers. I've been blown away. And I think that has really helped. That's one of the protective factors that I can talk about too, is altruism in children. Those acts of gratitude they've gone above and beyond. And I've also seen some parents ease up on academics, which is not easy, but focus on important things like playtime, and especially in the elementary level, family time and playtime. And I've been really impressed with parents who've had a lot to learn in a short amount of time, and those who have been mindful enough to take the time to just be present. So some positives and some challenges, but all in all, definitely something to keep an eye out for. And we'll talk more about protective factors because I have some ideas about that. Any questions?
Well, send your questions to chat as we turn on to Dr. Dodona.
Okay, great. Well, thanks everybody. Thanks for having me. Tiziana Dodona, psychologist at the middle school. Been with Pelham Schools for 11 years now. And hopefully while I'm speaking, there won't be any background noise. I have two little kids myself, but they're downstairs. So I put some feelers out for my colleagues in the high school, and I could speak to middle school kind of thematically, the concerns that have come up. And I think what we have kind of found is that there's this huge range. So issues that have come up for some kids have been exactly the area that other kids have really liked about this distance learning situation. And I think that's the interesting thing. It's been a really unique experience for each person. It's almost hard to make generalizations, but we've definitely seen from my older guys, anxiety around getting sick, anxiety around their family members getting sick, anxiety around, for those who were sick, actually recovering, and when will the symptoms actually go away, when will they be out of the woods. And then for those who knew people that passed, grief and how to grieve given these circumstances. So that's been central for those students. Another thing that has come up a lot has been like sleep disturbances. So they've had this kind of change in scenery, but the structure of their day, time-wise, really the demands were more or less the same, like they should get up at an hour in the morning that would allow them enough time to kind of be ready for several productive hours. But what's kind of happening is they are up late, whether it be because of video games and so on and so forth, and it kind of easily pushes the whole cycle later and later, and then they find themselves in the morning struggling to to wake up. Kind of the commonality for a lot of kids struggling with that, I do have to say, is video games. And I really feel for the parents with this one, because given that we've all been quarantined and there hasn't been much other opportunity for socialization, the way it's set up, video games have really been one of the primary ways that kids socialize with each other, which is a wonderful thing that it's like that. So I think everyone, even I would really be hesitant to put like black and white limits on it, like no video games, or even saying no video games during the week. Perhaps like when we had our conventional school day in the building, that was a common thing that families did, but they were hesitant to do that right now. So I feel for families, that's been a struggle, is structuring it in a way that it wouldn't impact their sleep and that they could still get their socialization. But it's been really, really important on the other hand, because it does kind of snowball. So there's this fine balance. Another theme that has come up a lot is boredom, like Dr. Desoy said. Interestingly, a lot of our kids are saying that they're struggling with the boredom. They don't like to feel bored. It's hard for them to tolerate the feeling of boredom. And then they describe kind of it triggering other things. So some kids will talk about how feeling bored will make them feel sad, or how feeling bored will make them feel anxious, or feeling bored will make them feel like they need to escape the feeling altogether. And then they, kind of go into this little pattern of behaviors that's unique to each child. So it comes up a lot. Then I have lots of kids who are kind of just relieved, and they just really enjoy the extra time at home. They enjoy the stressors of not being in the building, and especially in middle school, we have a very self-conscious age group there, and not worrying about the perceived judgment and navigating those things. And it's just the academic piece. Some kids find that to be a relief, while others, again, in stark contrast to them, think it's a stress to not have those pieces of their everyday life. There's a lot of thinking ahead. So the anticipation of what is the transition back going to look like? If school is going to be different in September, what should I expect? And that can really bring up some anxious feelings for kids in this age range. Then we have summer plans that have changed, and kids are talking a lot about that. So brings up disappointment. A lot of camps are closed and so on and so forth. So disappointment around summer plans. We also have problems with kids who have trouble attending their classes regularly, or like really sticking to a structure without it being imposed upon them the same way as it was before. So that's come up a lot in this age range. My colleagues at the high school say another theme is that students who felt like they were having a really good year in the building and then weren't able to keep up with the pace in the distance learning. They didn't quite generalize the same performance over in the different setting, and really feeling like all sorts of guilt and upset feelings around that. And then we have our seniors who have disappointment about all of their end of the year celebratory events that didn't go as planned. And then interestingly, there are some who are kind of happy and kind of feel like they dodged, the stress of prom or so on and so forth. So definitely a very wide range. But those are the things that I think are most thematic in this particular age range.
All right, thank you, Dodona. We only have a couple questions, so people write go to chat down there on the bottom of your screen and type in your questions, but we do have one here about tantrums. My mild-mannered kindergarten student is acting out tons. Everything is frustrating him, limited patience and no interest in academics. How can we speak age appropriately to a child in this age group, kindergarten? I fear I'm not talking him down properly. Dr. DeSoy.
I feel for you. It sounds like a kindergartner. Even without distant learning, that sounds like a kindergartner. It is quite challenging to manage tantrums. And on top of that, all of a sudden, kindergartners who learned everything that they learned in school through a relationship, through tactile experiences, environments, socialization is now being stripped from them, and they have to sit and attend in front of a screen, which is just it's just baffled my mind that I've even gotten some kindergartners on the screen. So that kindergartner is not alone, and I feel for you because it is very difficult to maintain a schedule. One of the things that when I think of protective factors that do mitigate psychological effects, and when I think about things that have helped parents, are daily schedules. And I know that a lot of parents have gotten advice from teachers or from other people. Oh, set up a schedule. But the reason that schedules work is because school provides a sense of rhythm and predictability throughout the day. And when you wake up at the same time every day and you get dressed and you have PE the same time and you know when you have recess, that is a sense of comfort, right? And what we want to instill in children is a sense of security. And children who are dysregulated and having tantrums are telling us that they don't feel secure for whatever reason. Parents suddenly have to be a teacher. They have to be the parent. They have to play a lot of roles. So to answer this specific question, I would, two things. One, I would definitely implement some sort of schedule if you haven't already. The schedule helps, the brain becomes in fight or flight mode when you don't have a schedule. And a schedule helps give them something to predict. It provides a sense of security. And the other thing is, really, we are all easing up on academics, and to push academics, to be concerned that the child won't be where they're at when they enter first grade, that will be up to our teachers. That will be up to the schools, because everyone will be at different levels when we come back in the fall. So easing up on academics for a kindergartner and really focusing on a daily schedule, letting the kindergartner choose the schedule and talk about it when they're feeling calm, avoiding any sort of conversation when they're having a tantrum, because as we know, when you talk to a child when they're having a tantrum, their brain is not working. So you could yell your ear off and tell them something very rational, but they won't understand it. So a schedule would be my suggestion. And I think easing up on academics too.
Can I jump in too? I'm sorry. Yeah. And it's hard to know without knowing more about the specific behavior, but just because Dr. DeSoy said a few things that triggered for me. And I think the language that you use during the tantrum, which should be minimal, but keep it to be like in positive direction. So when you're directing them out of the tantrum, I mean, you should probably walk away, not give them too much attention for it. But when you do need to give them direction, make sure they're it's positively phrased, right? So you want to tell them the appropriate thing you want them to do, as opposed to the thing you want them to stop doing, so that they can achieve it. And then you can reinforce them for achieving it, right? So when you're sitting safely in your chair, we can move on to this. Or when you're sitting quietly, which is different than stop screaming, or when your hands are safe, right? Which is different than stop throwing. So
Yeah, and tantrums happen for a number of reasons. It's hard to say what the function of that behavior is. At school, when a child is having a tantrum and it's getting in the way of work or academics, we do what's called a functional behavioral assessment. So we'll try and determine what the function of a tantrum is, because it's a form of communication. And sometimes it's avoidance, sometimes it's attention seeking, sometimes it's sensory seeking. So if you can get a sense of when it's happening, if it's attention seeking, then giving them more attention when they are calm, or when, following their lead in play, following their lead or what they're interested in, giving them overly too much attention when they are calm, and absolutely none when they're having that tantrum, because if that's the reason they're doing it. If it's avoidance, if it's to avoid a task, breaking tasks down into smaller components and smaller parts can be helpful too. I could talk about tantrums and behavior all day long. So if you want to keep talking, I could, but if you have any specific questions, you could always email me.
Just one final thing on tantrums.
Yes.
Everything you said, does it also apply to a 4-year-old?
Yes, 4-year-olds have less, their language is not as developed, right? So tantrums happen all across the ages, and they look differently, but the 4-year-olds, 5-year-olds, 6-year-olds, they still don't yet have the language to say how they're feeling. So I really think it's important for even 4-year-olds, right down to a 1-year-old, for parents to model what it's like to feel angry. So saying, I'm so angry right now, I'm so stressed, I'm going to go for a walk. If you can model as much emotion and talk about emotion and use the language of emotion, they'll develop an emotional vocabulary that they can use when they start to feel upset. Now, rarely do we have kids say, I feel sad, so I'm going to go into my toolbox and use my coping skill. But we do see kids who have a wider range of an emotional vocabulary are more likely to then identify what they're feeling and what they want, and get what they want. Emotions help us determine what we want. So even a 4-year-old, I think modeling feeling upset and validating their feelings, instead of saying, stop tantruming, go to your room, I see that you're really upset right now. It kind of helps that frontal lobe. So I've been given the analogy of the amygdala, if I'm using my fist because this is the brain. The amygdala is the part of the brain inside here that responds to fight or flight. So when you have a tantrum, you're in fight or flight mode. And this part of the brain, which is called the frontal lobe, makes decisions and makes good decisions, planning, organization. So they flip their lid. And I like to tell 4-year-olds and 5-year-olds, I use this analogy. You're flipping your lid, you're flipping your lid. And in order to bring that regulation back together, validating is what the research has shown. Validating a child's emotions. I see that you're upset. I can understand why you feel upset. Mirroring them really helps them to regulate.
All right, we have another question about how you can prepare children for kindergarten in September, with the possibility that they will be experiencing distance learning.
Mm-hmm. That's a great question, and it's a difficult question to answer. How we would typically prepare kindergartners is like what I said, a schedule. I think having a routine every day and having something to predict every day, something that you would do every day, is helpful. I also think visiting the school in a distance would be helpful. Maybe driving by, looking at the school, talking about what their expectations are, giving them time to ask questions, and giving them time to share even their fears or questions about it. Just having time to talk about it would be helpful.
All right, this question is not meant to be a political statement. The questioner asks how to talk to your children about the politics that they see on television and other things that they're seeing currently right now with the disagreements on television and the protests and the police, etc.
Mm-hmm.
Who would like to talk about that? Shall we start with you, Dr. Dodona?
Sure. So this is a tough one, right? And I think it's important as best possible to have the child lead you initially so you can gauge their understanding. You definitely want to correct anything they've kind of like misperceived. And that's why it's important to let them lead you initially. There's a lot of child-friendly resources that do a really good job with language that I'm happy to share. I could link. There's like a list that speak to, you know, racial injustices and so on and so forth. But I do think that they, depending on developmentally where they are, they may be more or less, you know, receptive to how much you want to tell them, right? So they might have a question that you'd be surprised on that it might suffice to tell them less than what you were anticipating. So take their lead. Don't flood them. Definitely don't you know, try not to confuse them. Simpler is better. But I think we also have to be really careful in our own biases, because everybody have them, so that when we're presenting information and we're presenting about both sides, you know, we present on why each side feels that they're right, you know, and not to necessarily impose, because I think it's a beautiful thing when kids really develop their own critical thinking and they're able to say, you know, that was really wrong. Things that are so blatant. I mean, the tragedy that happened and so on and so forth. I think you could speak to it as such. I think it's really important to also speak to how you can ensure their safety. You know, I feel really confident that you're safe here, and this is all the reasons why I know that you're safe here.
Right.
And there's gonna be probably a lot in the news and a lot about this on a lot of different outlets for a long time. So I think we also need to be really aware of how much exposure that they have. And this was the same with coronavirus. We were giving this advice very early on too, limiting exposure. Because even just from that, we worry about trauma just from the overexposure of information and not having a chance to keep up with the processing of how much is coming in. So just being cognizant of your own news intake, you know, what time is that happening? Are the kids around? Are they not? But it's such a big question, so I'm sorry that I wasn't too specific.
No, and just to piggyback off what Dr. Dodona is saying, when, especially for the younger children, when they don't know, they make it up their own story. So I would avoid the news, because the news can catastrophize a lot of the information, and we can even tell children that. But I would really keep the information accurate and developmentally appropriate, and as much as possible provide some hope in how things can change or what we can do. Give them a sense of purpose. There's a website I like called Embrace Race, and it's a website that's helpful. It provides books and resources to support conversations about race and inequality. I really like that website.
All right, thank you. This questioner also got into tried not to be political, but also talked about the president and some of the things he says. And again, but you're saying that depending on the age of the child, you take their lead. If they come to you with their questions about what is being said, what is on the news, then you have the discussion. We have another question here. One parent is considering not sending her 4-year-old to preschool because of the virus. Would this hurt the child when the child goes to kindergarten?
That's a really difficult question to answer without knowing who the child is. It is so dependent on the child and who they are and where their abilities are and how you feel as a parent. We have seen students who have thrived from going to kindergarten at 4 years old. And I assume you said pre-K, but I assume you mean kindergarten. And we've seen students who have just not been ready. And so it's all, I would really rely on your support system. Talk to your, if the student was in preschool, talk to the preschool teachers, ask what they think and how you feel about it. Usually parents have a pretty good sense of where their child is at.
I think the question was whether to keep them out of preschool.
Whether to keep them out of preschool.
Yes.
Oh.
We're going preschool, but then the following year entering kindergarten, and will they be behind or not?
They
Okay.
be hurt by.
Will be exposed to the virus.
No.
Oh.
Because of the virus, the parent is considering keeping the child out of preschool this September.
Mm-hmm.
Skipping preschool.
And I'm sorry, and keeping the child home.
Yes.
Oh, okay. Yes. Well, again, it is also another difficult question because it all depends on whether or not that's something that you can do at home. That depends on your work schedule, your own resources. If you have the resources, it's a difficult question to answer. But I don't think that there are any strong negative effects of not going to preschool if you have all the resources that a preschool provides.
Something that might help you make your decision, you might want to reach out to the people that do like kindergarten screening, right? For the school that your child would be attending, and asking what are the skills that an incoming kindergarten are expected to have, and kind of gauging for yourself how big that gap is for your child.
All right, this is a question regarding 10 and 11-year-olds that are struggling with depression because of isolation during the pandemic. What types of signs of depression or anxiety are beyond normal during a time like this?
That's a great question. And Dr. Dodona and I probably both can answer that question. 10 and 11-year-olds can either be fifth graders or they're sixth graders who are 11 as well. If a student is not getting out of bed in the morning, losing interest or pleasure in things that they usually enjoy, their eating habits have changed, they're feeling depressed or down most of the day, nearly every day, and it's been 2 weeks or longer, they're really not reaching out to any other support systems. They're not willing, they used to be interested in spending time with their friends and now they're not. That would be cause for concern, and then I would certainly reach out to a mental healthcare professional or provider.
Yeah, and I would also add changes in eating patterns, shifts in sleep patterns that can't be explained by, like I was talking about the video games before, socialization, negative self-statements, anything that is giving you an idea about what the thoughts are, even changes in weight, which would speak to maybe changes in eating. But definitely, especially for the kids, especially if they're not able to articulate it as well, like if depending on their behavior, what you're seeing, if they have a loss of interest in activities that they once did readily or once enjoyed.
Yeah, that said too, if they start talking about hurting themselves, absolutely reach out to a healthcare worker or a psychologist. The benefit of the time right now is that a lot of providers are providing telemedicine and telehealth. So you have just more options available. I know the Pelham School's website has a lot of psychologists on there, but I would start with your health insurance, and it doesn't ever hurt to reach out to someone. I would always err on the side of caution and reach out to a professional.
And then just to add to that, I mean, you can really understand how someone gets in that position, right? Especially when we kind of embarked on this journey, we were given such little, we had such little information about how long this would go on for and what's ahead, right? How ugly and big was this going to get? So there's these hopeless and helpless feelings that just can really come up naturally. And if we start asking too many questions about the future and we don't have answers about it, we can really engage in this rumination that's unhealthy. So we've talked a lot about mindfulness practices and how and mindfulness, when we say mindfulness, we're really talking about being present fully in the moment and non-judgmentally. And to be engaged mindfully, you can do, meditation, which I think is the association a lot of people have with mindfulness, but not necessarily. It could be just about any activity that you just keep shifting your focus back to the present moment. Mm-hmm. Because if you're mindful and in the moment, you're not engaging in that forward thinking to which there really isn't too much question answers. You have really only questions about it. So that's one important point. The other thing we've talked a lot about is radical acceptance, right? So when all of that disappointment comes up on, but this spring I was going to be on this team in this league and I had these events with these friends and it's not happening. And what radical acceptance is essentially just coming to terms with it is what it is. We are where we are. And, if we continue to angst about it or ruminate about it, it doesn't actually change anything. So let's make the best out of this moment. That's obviously a huge oversimplification. It's not that easy, but it's very powerful. And I think it's okay to bring that to kids' attention that we need to activate our mind in those two ways, right? So staying present as much as possible, radically accepting what we can't change, and of course, doing things that make us feel good. So even if they have a loss of interest in kind of initiating those fun tasks or those enjoyed preferred tasks that they did before, guiding them to do it. We kind of talk about the antidote to sadness is doing things that make you happy. And if you're doing things that make you happy mindfully, then you're not simultaneously thinking about the things that cause you the distress. And then hopefully you're reconditioning yourself. Those are essentially strategies in addition to, connecting with a therapist or someone who can guide you, especially if there's any concern about the self-harm or the hopelessness or so forth. But it's just great to have those things in practice.
And in addition to that, the radical acceptance and the sense that we have a purpose. The reason we're inside and we're isolated is for a purpose. There's a reason. And all of the research shows that the protective factor of altruism and gratitude and helping others, and I'm doing this for a reason, that my actions can help others, can really be protective in a situation where a child is feeling depressed. We just recently did, in one of my groups, a gratitude activity. And gratitude, you can do gratitude activities that are mindfulness activities, where you're thinking of someone that you don't like and you're wishing them gratitude, or even you're thanking the healthcare workers. Anytime you're engaging in an act of gratitude or feeling like I have a sense of purpose and I'm going to change something, you are putting yourself in a position where you feel less helpless, like Dr. Dodona said.
Okay, we have a very specific question here. So the two doctors are going to have to listen very carefully. This parent is asking about an 11-year-old with ASD, 11 years old, intellectual disability, approximately 7 years old intellectually, anxiety, but no medication. She's done very well with school one-on-one until something she does needs to be corrected, even if it's as simple as capitalizing a letter. When this occurs, she completely withdraws, begins crying, worries she's no longer loved, and frequently wets herself at this point. This occurs regardless of the approach. You're wrong, and sometimes even just coming back to the correction at the end of the day or on another day. This occurred before COVID-19, but has gotten much worse. Any suggestions at all?
So with our kids on the spectrum, and also with kids who have some verbal language impairments, and some of our intellectual deficiencies, we have a lot of good results with the use of social stories. When there's a recurring behavior, we like to kind of practice through the use of some sort of a visual representation of what the scenario, you know, could look like, and depending on their level and you know, what their own perspective is, you know, you can look up social stories. There's a lot of them kind of pre-made, but you can also design your own and use actual photos of the child and things in your home. But what I like to do is kind of show like the two different scenarios. You know, if you know, mommy corrects your homework, and then and you wanna explain kind of what the hoped for behavior will be, so that you can then show the positive outcome afterwards, right? And paint the picture for them that way. So that's a strategy. I'm happy to also put a link in the chat for sites that do a really nice job of having examples of social stories. But certainly anything that gives them practice. So that's one, that's the social studies of representation. Also role playing when they're in a calm, you know, in a calm place, giving them a chance to then reverse roles with you, and then maybe you being the child, so that they can be the one to give you the reinforcement for appropriately handle correction. All these things kind of help them internalize the script, if you will. Those are off the top of my head are some ideas. Dr. Desoy?
Yeah, I would agree. And I feel for you, because I think children on the spectrum, developmental disabilities, are in a much more challenging position than they are compared to their neurotypical peers. They've had a lot of support. So I would reach out to your networks of support. The student was probably working with a teacher in addition to other people or other teaching assistants, and find out what worked at school. And I would really reach out to them as much as possible. I wouldn't hesitate. I've advised parents to reach out to teachers on multiple occasions, but I think especially when it comes to students with disabilities, there are a lot of resources and networks of support. And for the parents, you really have to give yourself some credit and time for your own self-care. Easier said than done during this time, but it is crucial, because it is very challenging, the position that you're in, and I feel for you. But reach out to your support system as much as you can. Find out what worked at school.
Okay. What advice do you have about keeping kids occupied and happy and positive over the summer, especially if there's not much in the way of camps or pools?
Wouldn't it be so nice if we could just have all of our kids be positive and happy? I know. The summer camp cancellation, and that is challenging. I would get creative. There are ways that you can socialize with people but stay at a distance. I would come up, like I said, again, with some sort of schedule. You could even do a calendar. Each elementary school put out social emotional resources, and I think the secondary level did too, about different things that you can do. But that is going to be a challenge. Summer is going to be hard. I know that the district is planning on giving parents some things to do over the summer. I'm not sure if, I don't think they've handed those things out yet or given that guidance yet, but they might not always be happy, but at least we can come up with some sort of schedule, right, Dr. Dodona?
Yeah,
Anything else?
I would agree, Dr. DeSoy. And I'm thinking, if there's an opportunity to have the kids involved in the planning, I know there's going to be a virtual version of just about every activity, Lego, camps and so on and so forth. So maybe having a talk and seeing fitting in one of those things. I think a daily schedule continues to be important through the summer. I think it just reduces anxiety. But as social distancing guidelines become less restrictive, maybe talking about beforehand what your stance is on it as well, right? Some families are going to choose to continue to be very conservative for lots of good reasons. And it would be good for kids to know that they are going to need to manage that, maybe especially if they're seeing friends kind of out and about, maybe before they are. So that's something to keep in mind as well. But this is going to be a summer like no other for all of us. But please be on the lookout. The schools are compiling right now summer resources for every level, and we're going to be sending those out shortly.
We're getting a lot of thank yous here on the chat to our speakers. A few people have to leave early. I wondered if there was any difference in talking to the children about deaths of any close relatives due to the virus versus just death in general. I don't know if anyone in Pelham has had this experience, but how do we talk to our children about death of a grandparent these days?
It's a difficult topic, right? It's a difficult thing for all of us, even as adults. How do we grieve the loss of someone without being able to attend a funeral, without being able to be with the people we love, without being able to do our religious rituals that have become part of death and part of dying? It's a really challenging conversation, and it elicits a lot of anxiety in adults, which is why we worry about our children. There is a great resource. The Westchester Bereavement Center is a website, and it has a lot of resources on grief and dying and how to talk to children at each developmental level about death. And given these times that it's challenging because we can't be with the ones we love, but that we can keep them in our memories. And I've always thought that it was very important to talk about the memory of that person, what that person meant to you. Let's create something that we can keep forever to remember that person, keep that person alive by talking about them. There's a whole host of information on grieving. And Tiziana, I know you, or Dr. Dodona, I know you have a bereavement group, or there is one in the middle school. You might have some more insight.
We did this year. It kind of pops up depending on the need, but this is something that's very developmentally specific. I would be aware of, terms that you use with the children. When it comes to death, we tend to use very abstract or confusing terms, and we need to be aware of that when we talk to kids. We don't want to, say things like, oh, they're sleeping forever. I mean, when the kid goes to sleep at night, they might very well wonder, am I going to wake up from this? So it's very important to be kind of use terms that are accurate and concrete and not confusing. You definitely want to create like an open and supportive discourse so that they know they can ask you questions, but similar to comments before, gauge if they're ready to talk about it, and take their leads. If you have, a strong religious background and your faith guides the way you talk about that, that's okay. I think that often guides conversations about grief with children. Certainly, be prepared to repeat it and have to clarify. They may come back and ask you the same question. Validation that Dr. Desoy talked about is so important. I can, of course, and don't assume that you're going to know what they're feeling. I mean, certainly validate if they're feeling sad, but don't be surprised if they feel angry or if they feel abandoned or like, this person was supposed to take me somewhere special on my birthday and I can't believe that's not going to happen. Even those feelings, you can justify and explain why it wasn't done intentionally to hurt them, but even those feelings should be validated. Like, I understand why you would feel disappointed. Like, that's not going to happen and you were looking forward to it. The other thing is kids tend to personalize things. So just to be aware that they, depending on how vague the explanation is that we give them, they could personalize it and fear that for themselves. And certainly anything to commemorate the person, anything that would kind of help them express themselves, or feel like they're doing something that would have been, liked by the person that passed.
Yeah, I could put the Bereavement Center of Westchester has a great website, and it does give you symptoms of grief by age, how to help, how to talk to them. So I can put it in the chat, their website. I'll put it right here.
Okay, we have a question like, no one knows what's going to happen in September, and the parents are as anxious as our children. So how do we discuss this with the children? Then when they ask, how are the classrooms going to look? What's going to happen? Since no one knows, how do you tell a child that no one knows?
Well, you do exactly that, but you also say you will be safe. No one knows yet. We're trying to decide. Adults are here to keep you safe, and adults are working hard on figuring out what is the best way to keep you safe and keep you in school. And adults will be there to provide you security. Children need to know that they feel secure and that adults are working hard, which we are, on trying to figure out what the best way to re-enter school. So I would be honest with them and say that we don't know. And that when we don't know, we have a lot of uncomfortable feelings, and you might be feeling those feelings. What are some of the feelings that you're feeling? Validate that they might be feeling just as uncertain as you are, but also provide them a sense of hope. Adults are here to keep you safe. If you're feeling worried, you can talk to me about it. Or if you're feeling worried, you can talk to, Aunt Maggie about it, or someone that you love. It's, I think, important to give them a space to talk about it, and also to be honest with them about that we don't know what will happen.
And reiterate what we do know. We do know that you will be in school in September, yes. Right? What the building will look like, or how much of that's going to happen from home. Those are things we're still trying to figure out, but these are the things you'll be learning, and and just giving them more to hold on to, and then being aware of what are our questions and the things that we're uncomfortable with not knowing yet, and then really what's from the kids too.
Well, we all thank you, and this has been recorded, and it will be available on the Manor Club website, which is the Manor Club of Pelham.org. Probably not tomorrow, because I'm not that technical, but in a couple days. We thank you, Dr. Desoy and Dr. Dodona, and their emails are available through the Pelham Schools if anyone wants to follow up. And we are very happy that all of you joined us. We had a total of 22 participants, which is a nice record for the Manor Club evening programs. Thank you all, and good night.
Thank you, everyone. It was a real pleasure, and good luck with everything.
Yes, thank you so much for having us. I really appreciated it. And yes, good luck. Hope everybody has an enjoyable summer.
And you can feel free to send us emails if you have any follow-up questions. It's S. DeSoy and T. Dodona at pelhamschools.org.
Thank you. Good night.
Thanks, guys. Bye-bye.